So the test, am I audible now? Can someone just type in the message box that I'm audible? Thank you. So as we decided, I won't wait for the people to join in because it will take time. I'll just go ahead. So as we were discussing about test item cluster, especially in rotator cuff tear. So when it comes to rotator cuff tear, you have positive painful arc sign, you have positive drop arm sign, and you have positive infraspinatus MMT. If any of these two findings are positive, it's still the positive likelihood ratio is 3.57. So if any of the three findings are positive, the positive likelihood ratio is 15.6. So if all the three are positive, it's much better. There are some other cluster of test evidences are there, especially by McMurrells and Walton in 2002, who have told about SIRI, that is supraspinatus weakness, weakness in external rotation, impingement, that is your internal and external impingement signs or symptoms will be there. Now supraspinatus weakness, weakness in external rotation and impingement can be demonstrated like that. So when there's an impingement of internal and external rotation, so how you demonstrate is like just you take the arm in internal and abduction, sorry, forward flexion and do for internal rotation. And they will be just palpating at a rotator cuff tendon. If there's a pain, that means there's an impingement. Similarly, abduction, and you go for external rotation, similarly palpating at the cuff tendon. If there's a pain elicited, that means it is for impingement of external rotation. So this is one of the signs or tests which you do, which comes under SIRI. As I told, SIRI is supraspinatus weakness. That is, you go with full can test to assess supraspinatus weakness. Weakness of external rotation, that is your infraspinatus MMT, and impingement as it is demonstrated to check whether there is impingement of internal or external rotation. So this test or these three SIRI thing which was done by McMurrells and Walton is one of the evidences which can be used as a cluster for rotator cuff tear. Now there's a guy called Nicholas in 2013 did a test item clusters which included external rotation, lag sign, dropping sign, horn blower sign, internal rotation lag sign. So these four signs, according to him, if you do, indicates that the person is suffering from rotator cuff tear. Fine. So how to go about with this external rotation lag sign, dropping sign, horn blower sign? So it will be demonstrated now. For external rotation sign, lag sign, you take the arm in abduction, elbow in 90 degrees flexion, and externally rotate. If the patient is not able to hold the external rotation and it comes forward into neutral, that means the patient is having or this test is positive. Okay. Then comes your horn blower sign. In this, you just ask the patient to make in hand in abduction 90 degrees and blow the horn or blow the trumpet. Okay. If the patient is not able to hold the position and it droops, that means the patient or the horn blower sign is positive. Thirdly is internal rotation lag sign. Similarly, you take the arm backward, 20 degrees of shoulder extension should be there. If the patient is able to hold, that means this test is negative. But if the patient is not able to hold and it comes back to its position as if it is coming back, that means internal rotation sign, lag sign is positive. So these four tests, okay. external rotation lag sign, dropping sign, horn blower sign, and internal rotation. So first of all, we told about PARC, which had a drop on PARC painful arc test and age as positive for the cluster test. This is done by Nicholas. He tells that external rotation lag sign, dropping sign, and horn blower sign, internal rotation lag sign as positive. So as a cluster item which can be used as rotator cuff tab. As I told the PARC, one of the feature is age should be greater or equal to 60 years, positive painful arc, positive drop arm sign, and positive infraspinatus test. So here positive likelihood ratio is 28.0, while the negative likelihood ratio is 0.09. There's one more guy known as Littaker in year 2000 told that the cluster items for the rotator cuff tear can be age, that is less equal or greater than 65 years, weakness in external rotation, and night pain. As you see, there's no special test here. It's only the clinical signs and symptoms which have been noted and which tells that yes, when these signs are present and age factor and weakness of external rotation and night pain, that indicates that yes, the patient is suffering from rotator cuff tear. Now we have gone through the different clusters. Okay, the clusters by PARC, the cluster by Nicholas, and the cluster by Littaker. Now, this Nicholas researcher had told that there's a special test algorithm. That means you have to do a shoulder screening test. Okay, to rule out or come to a diagnosis, there's a rotator cuff pathology, there's an extra-articular pathology or intra-articular pathology. According to him, he has divided the shoulder pathology into three. That is rotator cuff, extra-articular pathology, and intra-articular pathology. Now, how you come to these three pathology is depending on your internal rotation resisted test. Okay. Here, what he is trying to say that if a condition comes to you and you do a screening by doing the internal rotation resisted test, and if the internal rotation resisted test is greater than your external rotation MMT, okay, if your internal rotation MMT is greater than your external rotation MMT, that indicates that the person is having rotator cuff pathology. So if a shoulder condition, remember the case which we have discussed in the front. So we have to apply all these things at the end to come to a diagnosis how it can be a rotator cuff tear. I hope everyone remembers how or what was the scenario which I was presenting it. So what Nicholas is telling, I'm repeating again. If a shoulder condition comes, you have to screen that condition. Yes, you have to go with your patient history, you have to go with your physical examination. But when it comes to special test, okay, you have to screen that condition by doing your internal rotation MMT. If the internal rotation MMT is greater than your external rotation MMT, it indicates that the person is having rotator cuff pathology. Same time, if the external rotation MMT is greater than your internal rotation MMT, that means the person is suffering either extra-articular pathology or intra-articular pathology. Fine. So you got a clear idea now. So if a shoulder condition comes, you did all the subjective, objective analysis or examination. Now comes your test item cluster. Now before going to a test item cluster, you can include this internal rotation MMT. Basis on that, you can divide it whether it is a rotator cuff pathology, whether it is an external articular pathology, or whether it is an internal articular pathology. So your test item clusters helps into accurately diagnose it is a rotator cuff tear. Fine. Okay, I hope everyone understood this concept. So this was devised by Nicholas in 2013, where he has very clearly told there's a shoulder screening test by internal rotation MMT do help to identify the exact pathology, and doing the test item cluster helps you to accurately diagnose a condition. So you don't have to go to MRI, you don't have to go to any other expensive test. You do these things, you get a proper diagnosis and you start your management and treatment. Fine. Now, coming to a conclusion, before conclusion, I want to rethink or whatever the case scenario I have given at the starting. I hope everyone remembers. It's a 67-year-old guy who has night pain, who has so as I told about the case scenario, one is 67-year-old guy with night pain, with overhead abduction pain, traumatic injury, and it has progressed. The pain has progressed over the time. Now we can have a very casual discussion how to go about it with whatever the concept we have just learned. Can we just discuss how we can go about it? If any of the PGs and final years can help me out. You have the age factor here, which is 67 years old, right? You have a clinical features or symptoms, that is night pain. It is a traumatic injury. Fine. There's a overhead abduction, painful, and it has progressed. The pain has progressed over 2 or 3 months. So how you will come to a conclusion? What kind of a pathology is it, or how you will come to know what kind of a test? Because see, this test item cluster is not only for rotator cuff tear. It will be there for each and every condition. Especially you will be having test item cluster for impingement also. And shoulder condition is such a condition where it's always confusing whether it is a rotator cuff tear or whether it's an impingement. As it's told, it's an umbrella term. You don't know how to clear cut come to a precise diagnosis. So this, as I told again and again, this test item cluster do helps us to come into an accurate conclusion. So I have given a case scenario. How will you adapt this screening test to this thing? Can the PGs help in contribute this discussion, or the final years or interns, whoever is there? Just a casual. I'm not going to cut anyone's mark out here. You can just unmute yourself and speak, or you can just type in your chat box, because it will give me an idea that yes, you have understood something today. Anyone can unmute themselves, or you can just type in the message box. How to go about this case scenario? Or what are the steps, or what are the things you will do to come to a particular pathology or particular thing? think you people can unmute yourself and speak, not an issue.
Ma'am, night pain is there, so maybe it can be rotator cuff tear or bursitis. And for overhead painful activities, many conditions are there, impingement, and also we have to perform the test to to diagnose whether it is rotator cuff or not.
Yes, correct. So I have given you all the subjective assessment here. Okay, the objective thing we have to perform, that is your clinical test, special test, or the test item cluster. So such kind of a person has come to your clinic. Okay, you don't have any accessibility to the investigation or anything. What is the next you will do now?
Collect proper history, and after that perform the special test.
Yes. Now, how will you go about your special test? Will you do each and every special test, or you will go for test item cluster?
Ma'am, first we should check that
Cluster.
painful arc syndrome, painful arc sign we have to check first.
Okay.
Then if painful arc sign is positive, then we have to go for like differentiate any special test for like rotator cuff tear or any particular muscle tear or not.
No, that's what I'm trying to make you understand through this, what is a presentation. We have got subjective data. Okay. Next is your special test. Now, before you go to special test, you have to rule out, or you have to have some kind of a provisional diagnosis, whether it can be this, that, or this. Okay. That's why that time I told you can go with this internal rotation resistant or internal rotation MMT. So if the internal rotation MMT is less than your external rotation MMT, that comes to a conclusion that it is a rotator cuff pathology. Okay. So you have the subjective data. The next is your objective evaluation. That comes your special test. Before you go to a test item cluster or special test, which you want to do individually, rather than wasting your time, you come to a diagnosis or probable diagnosis by doing this internal rotation MMT. You do internal rotation MMT of, in that shoulder joint. If the internal rotation MMT is less, okay, compared to your external rotation MMT, that means that person has rotator cuff pathology. Now you have come to an idea that, yes, you have come, no, let me complete. Now you have come to an idea that rotator cuff pathology is there. Okay. Now you do your test item clusters for rotator cuff tear or rotator cuff impingement. So rotator cuff impingement, the test item cluster is different, which I have not discussed here. I have only discussed about rotator cuff tear. Now for this type of a condition, okay, you will use which kind of a cluster test? Will you use Spark or will you use Lickardt's? Now I'll just show you what is Lickardt's and KSHAMA. For you, it's very easy to understand. So this is Spark, where the age is one of the factors. You have positive painful arc, you have positive drop on sign, and you have positive intraspinatus test. But here there's no night pain. Okay. In Lickardt's, the age is there. You have weakness of external rotation, and you have night pain. So most probably you'll be using the cluster of Lickardt's rather than PARC for this condition. Now the whole scenario or the whole idea I want to tell you that there's something called test item clusters which you can use or utilize, which helps you to prevent time. And you can come to a particular diagnosis and go about your treatment and management as far as possible. Rather than waiting for other investigation or something, you have to start with your management and the patient care. So the recovery happens fast. You don't have to wait for any other investigation, and these are the cluster tests which will help you to come to a particular diagnosis. That is the intention why I took this seminar or presentation. If it is very clear for you, it's well and good. Any more discussion on that case scenario? Tapaswini, Devashish,
No, ma'am.
any more questions you want to clarify?
Ma'am, in acute cases, internal rotation will also be limited. So how can we say that like MMT of internal rotation, like if he will be not be able to do because of pain, so how can we do?
Maybe first we have to reduce the pain factor, then we go with the assessment part. But internal rotation and external rotation MMT will be there, right? If internal here, that's what the Nicholas was telling in the screening test. If the internal rotation is less, but external rotation will be fine, right? If you compare your internal rotation and external rotation, it will be much lesser than the external rotation. Is it necessary that all the movements of the shoulder joint will be affected? Especially when it
No,
comes to tear.
no.
No, ma'am.
In an acute condition, and as I told before, rotator cuff tear, it's not necessary it has to be symptomatic. Sometimes the patient will be asymptomatic, but they have rotator cuff tear do come up. The pain will be only in the movement. You won't have pain throughout, or consistent or night pain won't be there for them. That is for asymptomatic rotator cuff tear. But yes, when it comes to symptomatic rotator cuff tear, yes, but in such a scenario, you can go with that, the screening test, where internal rotation will be affected. That's what we want compared to external rotation. Internal rotation will be less compared to external rotation. And the other test, that is your external rotation lag sign, internal rotation lag sign, your dropping sign, horn blower sign, that has to be assessed, right? Anyways, if a patient comes in acute or chronic, acute, you will be doing some special tests, right? So why don't you do this test item cluster to come to accurate diagnosis within some time? Correct?
Yes, ma'am.
Anything else anyone wants to ask? Any doubts you want to rectify or clarify? So,
Ma'am, I have one doubt.
yeah, sir. Yeah,
Ma'am, in which
yeah. Hello, Devashish.
hello,
Yeah, speak.
ma'am, in which condition we can use that Park test item cluster or Nicholas Park item cluster on any kind of test item cluster? In which condition we can use? Like how we will select the test item cluster which we should use?
Normally we use path, or the efficiency or the accuracy of test item cluster for rotator cuff injury, rotator cuff tear is path, where you mention about painful arc sign, drop arm sign, infraspinatus, this thing. Okay. So that is what you say, evidently, according to literature, is one of the more accurate test item cluster for rotator cuff tear. So if it is rotator cuff tear, you can go with path. Age. Normally, what they say, age is the contributing factor to come to that diagnosis of rotator cuff tear. Normally, age above 60 to 65 years do come to a conclusion, and what we say, one of the predicting factors that come to a diagnosis of rotator cuff tear. So we have to use spark. According to the evidence level, this spark is the most accurate test item cluster for rotator cuff tear. This Nicholas
Okay, ma'am. Thank
thing,
you.
the screening test, I added it. It's not there. In a sense, in his study, where he's telling as a special test algorithm, if a condition comes to you, you can follow this algorithm to come to that particular pathology. And how is that come to that particular pathology is by doing that special screening test, that is internal rotation resisted test. So depending on your internal rotation MMT, you can divide whether it is rotator cuff pathology, intra-articular or extra-articular. So when it is, you come to a thing, yes, it is an intra-articular, rotator cuff pathology, you can use spark on it, test item cluster. So it will be more accurate. Correct?
Yes, ma'am.
So can I conclude this session or wrap up?
Ma'am, I have one doubt.
Yeah.
Ma'am, if is symptomatic and patient is in chronic condition, at that time we can conclude that the patient is having rotator cuff tear with the help of Park and Nicholas, as you told, ma'am.
Can you repeat your question? And this is Dharmita, right? Can you repeat the question?
Yes, ma'am.
Yeah. Can you repeat?
Ma'am, I'm asking that if patient is asymptomatic, as you told that patient can be asymptomatic in rotator cuff tear.
Yeah.
So if patient is asymptomatic, at that time we can conclude that patient is having rotator cuff tear with the help of this Park and Nicholas classification.
No. If the patient is asymptomatic, the patient won't come to you. Correct,
No,
right?
ma'am. No, ma'am. As you told now that patient
Then
can
there
be
will be
asymptomatic.
pain. No, that's what I'm telling. Rotator cuff tear, mostly you will be having asymptomatic patient. I'm not telling you won't be there. Most of the asymptomatic patients do have rotator cuff tear, which goes undiagnosed many a times. But when it is asymptomatic, that patient won't come to for any treatment to you. Why the patient has to come to you? He's fine. The patient will come to you only when there's some symptoms, only when it's pain. Correct? When the
Yes, ma'am.
patient is asymptomatic, why he'll come to take physiotherapy? And yes,
Or
if
ma'am,
it is asymptomatic, only through MRI you can come to a diagnosis. You can't come to a diagnosis through this test item clusters because you don't know whether it's positive or negative, or you may get false positive. Correct?
yes, ma'am.
Yeah.
Okay, ma'am. Thank you, ma'am.
Did I clear your doubt?
Yes, ma'am.
Okay, so I can wrap up this session by telling that yes, test item clusters do play an important role when it comes to diagnosis of particular condition, especially when it comes to shoulder condition. As we all know, those who are treating patient in clinics and who have come in exposure in treating patients, shoulder is a condition, or what we can say, it's a very confusing conditions where you don't come to a particular diagnosis accurately. So this test item cluster do help to come to that accurate condition bypassing the investigation technique. Yes, the investigation techniques are helps to confirm your diagnosis 100%. But suppose you don't have that investigative, what we say, uh, mm, accessibility. It's not available in and around your place, and you have to come to a probable diagnosis. This is one of the things which will help you out to come to that probable diagnosis or confirm the diagnosis so that you can improve the patient, start the treatment immediately, improves the patient outcome, and obviously it reduces the time and the time and cost spent on your MRI and other imaging techniques. So as a clinical, that's what I told. This test item cluster is a collaborative effect of your history, your physical examination, and the special test. You should be knowing your history thorough. You should be knowing your physical examination thorough. And you should be knowing and the knowledge of your special test. The only difference, rather than doing single test for each and everything, you do a cluster of tests which helps you to accurate your diagnosis and confirm your diagnosis. Yes, I did this test item cluster. It denotes rotator cuff tear. That's it. You do a test item cluster for impingement. Yes, you come to a diagnosis. It's an impingement syndrome. The only difference here, before you do the test item cluster, which I included, is your internal rotation MMT. It helps you to come to a pathology, a particular pathology, or is kind of a screening device. Whether that pathology is shoulder, rotator cuff, intra-articular or external articular. So that screening test, if you do, you come to a which pathology also. Depending on the pathology, you can do the test item. So rotator cuff pathology, whether it is rotator cuff impingement or rotator cuff tear, you do test item cluster for that. Extra-articular pathology, you do test item cluster for that. Intra-articular pathology, you do test item cluster for that. Finish. You know your probable diagnosis, you know what you're doing, what treatment you're going to do, and how you'll manage it. I hope this session was very knowledgeable, very interactive, and you kind of take some home message from this session. So I'll end up. I want to thank all the PGs and students who have come and participated in this session, staff who have been involved in it. Any doubts or any clarification, you can please. Thank you. I'll just end the meeting. Thank you for attending this.
Thank you, ma'am.
Thank you, ma'am.
Done, right? It was good.